Welcome back to Mass Appeal. There are many cancers that can be cured if they're detected early. Jamil Maldonado and Taishania Guzman from the Noel program Early Cancer Detection are here to help us spot cancer before it's too late. Ladies, it's a pleasure to have you here. Let's first talk about the program a little bit. What can people expect and why is it so important?
Well, the Noel program is a pilot program. This is our first year actually heading it up, and what to expect from it will most likely be educational services that we provide, and what we do is a little bit of outreach. We go into senior centers, 55 plus neighborhoods, and try and give informational sessions on colorectal cancer, breast cancer, and cervical cancer. After that, any members of the community that are lacking health insurance, transportation services, even companionship to get their colonoscopies or mammograms done, we provide for them, and that's considered patient navigation. So what we'll do is link them up with Tapestry Health Center, who gives them a voucher if they don't have any health insurance to get their colonoscopies done, and we'll help them with scheduling the appointments if they need interpreters, and go in and sit with them while they get their colonoscopies or mammograms done.
And if there are people out there who are thinking that they could really use these services or they'd like more information on how to spot cancers, how can they contact you? How can they get in touch?
Well, we are located at 120 Maple Street in Springfield, Mass. And I do have to say that this program is targeted towards members of the Springfield community only. So if you are a resident of Springfield between the age of 40 and 64, give us a call. Our phone number is 788-4649. That way you can contact us. You'll reach either myself or Taishania directly. And we can link up with you, and if you're interested in coming into one of our informational sessions, then we'll let you know where we're hosting it. We can do an intimate one if you don't feel comfortable, and you can do it right at our office at 120 Maple Street. And then if you needed to get some navigation going, then we can get that started for you as well.
It's some of the most important information that you can give out to people here in Western Mass. So right now, if you don't mind, I'd love to talk to you about some early detection signs, because a lot of people out there, they don't know. And that's really the killer. When people don't know how to check themselves, that's what comes back to bite you. So maybe shall we start with breast cancer? How do you help early detect breast cancer?
Well, the first thing is to always have your monthly self-examination done, and that's what you do in the comfort of your own home, and just get to know your body, get to know you know, the signs and symptoms at home. If your skin texture is changing on one breast more than the other, if there's any
dimpling going on, if there's any dimpling going on, if you're having discharge that is not normal out of one breast, that's a sign to look for.
And it's the self-checks that really...
Correct. The self-checks really help, because you need to know your body, and then you need to have an open relationship with your primary care doctor if you have one, and to make sure that they know your family history, because, you know, although it's not an end-all be-all for you to get breast cancer, it is a risk factor, so you do want to talk to your doctor about any risk factors
and the earlier you can detect it, the better. And oftentimes we were talking about earlier, mammograms, sometimes they don't start until you're older, so if something happens when you're younger and you catch it, it's better. What about other kind of cancers, Shania? What do we need to know?
We obviously focus on breast, colorectal, and cervical cancer. With the colorectal cancer, some things you may look for is obviously any changes in your bowel movements, any abdomen pains, things like that, which we all know can be other stomach issues, but that's once again where you need to advocate for yourself, talk to your medical professional, and let them know you're having these symptoms so they can go ahead and check you. And speaking about if these symptoms are happening at an earlier age, if you bring that up to your doctor, they can make the determination to have the colonoscopy at an earlier age. You don't have to necessarily wait till 50, because that is the cutoff age to have your colonoscopy. With the cervical cancer, just your yearly PAP. Which is going to be changing soon. They're going to be only requiring it every 3 years, but that's very important. Just knowing your body and just staying updated with your appointments is...
That's what it is. It's education and it's awareness.
Definitely.
And if we practice both of those things, I think Western Mass is going to be a lot safer and healthier. Thank you very much for coming on and spreading the word. It's a word that needs to be spread. For more information, just go to mymassappeal.com.